explore this area a bit further. In your practice, what do you think are the key differences between a doctor of public health and a PhD program? And what type of students might be a good fit for these two uh, diverse career paths?
Yeah. Um, I think so. First of all, I'll say at the end of the day and in the global scale, right? You or others will call me Dr. Anna, and there's no caveat about like what are the letters that
Mm-hmm.
create that
Yeah.
doctor. And I think that so many people have that concern when they think about DRPH versus PhD, right? Is this going to make me competitive? What does this mean about my career? And the first thing I'll say is, yeah, I mean, absolutely. Getting a doctorate will transform your career, and it almost at that point, like you don't really have to compare what's going to get you further. It's about what is the better fit for your
Mm-hmm. Mm-hmm.
interests, and
Yeah.
that's why I like lead into that is because you really have to think: do you want to be a researcher? Right? Do you want to specialize in methodologies and like sort of live and breathe research? If the answer is yes, then the PhD is for you. If you're really more interested in like how organizations work, management and leadership, problem solving, but on this sort of, different kind of scale, then a DRPH could be a really good fit for you because it's not going to focus so much on the methodologies of research. It's going to focus on how do you lead teams, right? How do you understand the questions, the stakeholders? You know, and yes, you're going to understand how to interpret data, right? I
Mm-hmm.
think that's really
Yeah.
critical. But you're not going to have to do this data coding, right? And you're not going to, right? And for me, that was so critical. I was like, oh, I don't want to do any of that, but I love this sort of like different kind of higher level
Yeah.
thinking.
Yeah.
Yeah.
I think you've summed it up perfectly. If you want to live and breathe research,
Yes.
then PhD is your route. But if you want a more practically oriented, career path, then a DRPH can be a good option. But do you think there can be an intersection where, for example, a PhD can find themselves back into a lot more practice, and DRPH can also find, themselves back into a more research-oriented field post
Yeah.
graduation.
Yeah, of course. I mean, I think there's so much flexibility in what we do. And so much of that is saying yes to different things, right? It's about embracing the opportunities that come and that are of interest. I think I'm a DRPH who spends probably more time in research than most.
Mm-hmm.
So I'm straddling it in a different way than a lot of my colleagues with the same degree. So yeah, there's so much flexibility. It's really more about like what kind of experience I think you want out of a program in the first
Yes.
place. And I
Yes. Yeah.
think that's kind of your audience, right? People who are considering these programs.
Mm-hmm.
And, for me, it's all about the experience. Like, what do you want to learn? What do you want to be able to get out of it? What skills do you want to develop?
Mm-hmm. Okay, that's fair. So, in terms of the application itself for prospective, applicants, what should they consider, or what factors should they consider when they are choosing between either a DRPH or a
Mm.
PhD program? I know you've spoken about research and others, but are there other factors for them to consider which one to choose, to make sure that is a right path, is a right career path for them?
I mean, let's be honest. One of the biggest things that anyone has to think about with these programs is funding. And the truth is, DRPH programs often do not come with full funding,
Mm-hmm.
because it's mostly, I mean, at least at Hopkins, I consider my experience, it's mostly people who are currently working. So they're part time, and they might be able to get funding from other resources like their jobs, but very few are offering full funding. And I think so, yes, I mean, for me, the first thing you think about is what do you want to get out of it? And the second thing is, okay, so then what's actually realistic? Because I don't believe that most people really benefit from taking out student loans, over and over for all of these degree programs. For
Mm-hmm.
many international students, that's not an option to be able to do that. And so then I think the second component is what are the resources that are going to be given to you that are
Yep.
going to make your life a livable one. And then the third thing I would say is like the people you work with is the most important thing,
Important.
right? And it's not about the project or the topic. What you do on your dissertation, I mean, if you're still doing that in 20 years, I'm going to be surprised. Like that's not the thing that matters. It's the relationships you're going to
You
build. So
build.
you want to
Yeah.
find people who are fun and supportive and who will like really be advocates for you in your career.
Mm-hmm, mm-hmm. Yeah, I think you've raised some the important factors for consideration. So apart from your own interest in whether you want a research based or a practice based program, you would also want to consider what resources are available. And as you highlighted, um, PhDs, most PhD programs often comes with funding as compared to a DrPH program. And also, if I think if in terms of the flexibility, as you said, a DrPH program will help you. You can work whilst in
Yeah.
school, so that is another option. If you don't want to resign from your current role and you want to continue getting an advanced degree, then the DrPH path it's a perfect fit because I don't.
And that was
Mhm.
a huge consideration for me actually was, I spent a long time between my master's and my doctoral program and I see how PhD students live. And I thought, like, no, that is
I don't
not
want
at all
that.
for me.
Yeah.
Like, here I am, I'm like a full grown adult with a salary, like living life. I am not going back to like, PhD student status.
Mm-hmm.
And, it just didn't make sense in my life. So that was
Mm-hmm.
that other component for me that
Yeah.
was really like, okay, I want to still work and I want to be able to apply what I'm learning to my job
Mm-hmm.
now. And that was really important.
Yeah, I think that's a very important consideration, at least for the flexibility. I know Hopkins, the DRP program at Hopkins is highly flexible,
That's right.
but I think other programs might still require you to come on site for a DRPH program. But the one at Hopkins, I know a couple of people who like are still in their home country and they are enrolled in the DRPH,
Yeah.
so that at least that is a good thing. Um, so in terms of career path, uh, what are the typical career opportunities available for graduates of DRPH versus a PhD? I know we talked about how each is flexible, but traditionally, what is the typical career path for someone with a DRPH program versus someone with a PhD program?
I think the fun thing is that there's no typical. I look at the people who are a part of my DRPH cohort, and they're doing such different things.
Mm-hmm. Yeah.
One person was in charge of a major health system.
Mm-hmm.
One person, there were people in high level government positions at the.
Okay. So yeah, so I think that we've had an enlightening discussion. Mm-hmm.
All right, yeah. So I would just say there's no typical, and that's the fun of it is that you can really apply these skills to almost anything that you're doing in public health. And something I really appreciated was being around people,
Mm-hmm.
not just global health people.
Yeah, we
Yeah.
can hear you.
Okay. Sorry.
That's fine. We can hear you. Mm-hmm.
So, one of the things I really appreciated about my program was not just being around global health people, right? Getting to see how other people were planning to apply this to their work, not in academia, not just in global health, but from domestic perspectives in all types of jobs.
Mm-hmm. Great, great, great. Um, so I mean, as you've said, a career path is it's a bit flexible, and these days even the uh, those being trained to breathe and leave research, leaving the research field after graduation. So you are allowed to take